Hi! In this video, I'm going to be showing you things that I've never shown you before. It's going to be things that you've been asking to see for a very long time. Everyone's been wondering, but I'm also going to be showing you stuff that you never expected to see. Like my insides. Literally, like, filleted open like a fish. I'm going to be literally chopped in half and put back together, and I'm going to show it to you. I'm going to show you all of it. And I'm really nervous, but really excited. This is my skin removal journey with Dr. Katzen. Well, hello there. This is the moment you have all been waiting for. Nick, show us your body. Show us your body. Well, here's my body, you perverts. I'm gonna get it chopped off.
Shibbly bang bang, shibbly little bang bang.
We are finally addressing the loose skin issue. And everyone's right. Well, actually, no, a lot of people are wrong. They thought I already got the surgery. No, I've just been hiding it really strategically under my clothes, but this is what I look like when I sit. So when I'm doing my mukbangs and I have the table here, this is what's going on underneath. I mean, sucking it in, squeezing it, doesn't matter. There's just so much skin. And I am at Dr. Katzen's to get it all chopped off. I'm so excited because it's the last piece to this putting me back together story, you know. It's not just me, it's everybody who loses a lot of weight. So, yeah, I couldn't avoid it. I'm just like everyone else. I didn't have like a special pill that I took to make the skin just shrink back. This is kind of just the reality of being really big and losing a lot of weight. You're gonna have loose skin.
Are you afraid of the scars?
No. It'll tell my story, you know. It's my battle scars, my self-inflicted battle. That's funny because this was all my doing. That's the really funny part. Like, I did this all on purpose. I wanted to be really fat and be a big fat bubbly character, whatever, and everyone got that. And I'm still me. I'm still that bubbly character. I just, you know, now I'm left with this. So, wait, what was the question?
So we're gonna meet Nick now. Hey, there he is. How's it going?
Very good. So good to meet you.
Nice to meet you. Thanks for coming all this way. No, that's fine. Thanks for coming all this way.
Of course.
Good. So you've been busy with some surgery, huh?
Yes.
All right, good. When was your surgery?
1 week ago from today.
All right, good. So he's a little bit swollen, a little
Yeah.
bit black and blue, but otherwise looks like healing up fine. Yeah, looks really good.
Yeah.
So we got project number 2.
The bigger project.
Yeah.
The more important
body.
project.
Yeah. All right. Thought about a body lift 360, you know, tummy tuck, hip lift, buttocks, and then also the arms. Is that what you were thinking?
Correct.
All right. Very good. And then maybe a vertical, like down the side of the chest, torsoplasty, and then maybe the inner thighs too.
Correct.
Okay. Very good. So let's take a look at tummy. All right. Very good. So what I see are stretch marks, okay, which are evidence of your skin being stretched out, and it couldn't contract 100%, so that's why it's a little bit lax.
Yep.
Okay, very good. And I see a little bit of muscle weakness here. That is the six-pack rectus abdominis muscle sort of bulging out here. Mm-hmm. So that means to say if we just got rid of the skin, the tummy would still stick out because the muscle is sticking out. Mm-hmm. So we need to do 3 things: get rid of the skin, get rid of the fat, and then plicate or bring in that muscle. And from that, when I make the incision low down here, I lift up the tummy like that. I go all the way up here from the inside, and then plicate or bring in that muscle and get that nice and flat. You'll get an awesome result. All right, good. So let's see the backside. Very good. All right, very good. I'm just gonna bring this down a little bit. Very good. Classically, men carry their weight a little bit higher than females. So you, men, male, carry the weight high above on the hips here. Yes. Females carry it a little bit lower here. So when I do the body lift, I make an incision from the top of the buttock crack here, front side, the tummy, and then what I remove is this chunk. All right. And that does a couple of things. One, it brings up the wrinkles on the buttock. Okay, it gets you that.
Yeah.
Okay. Look at that's going to be awesome. And it cleans up the lateral thigh too. As the incision comes around the front side, I go pretty low in the pubic region. Okay, so in the pubic region, I reduce that area. I lift up that ball of fat that's at the top of the pubic region. And then from that incision, I go up to the belly button. I unbutton the belly button, making an incision around the belly button, push it in, go clear up to the sternum way up here. See that six-pack muscle, pull all that in, flatten all that. And then usually I can get out the skin from here is pulled down to there. It's not that the pubic region is pulled up. Is that this tummy is tucked, if you will, by pulling that down. So if you map out your freckle lines, these 3 freckles will be down here when we're done. Okay, and all this will be gone. Basically, I'm removing like an inner tube all the way around. Good.
And then the other biggest concern was like, as you can see, I can literally pull my skin like a French bulldog.
Yeah. What I prefer to do is to make an incision from the armpit down the side, and in that way, I can get rid of the skin like that. So if I were to do just lipo, you'd have hanging skin. Okay, so you really need to get rid of the skin.
Skin.
Yeah.
My arms were like this big.
Cool. So make an incision from the armpit out to the elbow there, and we'll get your arms like that. But something like that so you can build muscle mass on top. It's this area that bothers you.
Yes.
Yeah.
You can see all the...
Yeah. So the best way to do that is to make an incision from the groin to about down to there. Knee looks pretty spared, so I would bring that down to there. And like, look at that. There you go. So what I try to do is I try to do areas that bother you the most first. So on most males, it's typically the tummy, hips, and backside. So we bang out the body lift. And then we figure out what bothers you number 2. So I would probably do the arms. And then since the legs bother you the least, we'd probably do that round 2 with the chest. And in terms of timing and spacing and everything, I'd separate them maybe about a month in between. Okay, I know you have a tour May and June.
Mm-hmm.
So
be after.
Okay, yeah.
Is it possible to do the stomach and the arms together?
Yes.
Okay.
Yeah. So I would do the body lift, tummy, hips, and backside, and the arms together. Yeah. Round 2 you could do after the tour. That's fine. Would be the torso here down the side and the thighs.
Okay.
All right. Sounds like a plan. Good.
I'm just kind of sharing. This is like my journal here. I'm just showing my life. I guess I will say thank you for watching the videos. I mean, in one sense, it's like I'm here because of them too. Because I would not have gotten that fat if I couldn't make a living out of it. If I couldn't, make good money, get good views, put myself out there. If I couldn't build a career and a following, I would have never got fat. So in a way, I'm here. I'm in this chair right now because of them, because they were watching all the videos. So it's your faults. This is your fault. They're gonna hate me. They're like, this is your fault, Nick. This is all your fault, people. This is your fault because you watch the videos. You all enablers encouraging me. But oh well, there's solutions to everything in life, and I chose an amazing doctor. And I'm in the 90210. Like this is capital of plastic surgery, you guys. At least I got a good doctor. This is holding me back. This is really holding me back. I can't even wear a normal shirt or like sucking it in. This is holding me back from feeling my best. And I wanted to feel amazing and feel really good on the tour, and also wear cute clothes. I feel like there could be some inspiration here. Not to say I'm the most inspiring person, but you never know what it will be for someone to maybe they're looking for that sign and they're thinking about getting skin removal surgery. Maybe they were overweight like I was, or maybe they just gave birth and they just need a tummy tuck. They're like, I don't know if I should do it, and I just need a sign, and maybe this will be the sign. Or there's help for you out there, and there are great doctors out there, and I'm a pussy with a capital P when it comes to like medical and being scared and stuff. If I'm willing to tackle this and I come out alive, I know you can as well. So
zoom in there and just kind of breathe.
abs.
Yeah, breathe in, breathe out, and then and then slowly pan out. Good morning, everybody. So today we have a very special VIP patient. Comes all the way from Florida, Nikocado. Yay! Hi. Good. And he is here to get rid of a lot of excess skin and fat. He's lost an amazing 253 pounds.
253.
That's insane. So that's a great job, and we're here now to get rid of excess skin. So with that weight gain and that weight loss, he has developed some skin that's stretched out but just can't bounce back. If he were to lose more weight, that skin it just gets saggier.
Yeah.
So there's no way for the skin to recoil. So you have some stretch marks here that indicates that that skin has been stretched out and is not going to bounce back anymore. So the only way to get rid of it is with surgery. So what we're going to be doing is focusing on the abdomen, hips, and the backside. The first thing we're going to focus on is on the backside. And what we want to do is we want to make an incision high up here, sort of in the love handle regions. He wants to get rid of some love.
All of it. Chop it off.
Okay. So we're going to focus on the love handles here, superior iliac crest. So we're going to make an incision from here, across the top here, dissect down to the buttock, and remove an area of skin and fat from here to here, raise this up, and raise the buttock up, and to get rid of sort of these indentation, or we call shrinkles. These are wrinkles that develop after you shrink or lose a lot of weight. So as this incision comes around the hips here, the incision's going to carry out over the hips. We're going to raise this up, get rid of all that excess skin and fat. Look at that. All that excess skin and fat.
Skinny.
Love be gone. All right, very good. Now, as that incision comes around over the hip, we're going to flip him on the operating room table, and then we're going to make an incision low down on his tummy, low down in the pubic region too, raise the pubic region, reduce the pubic region, and then from the inside, I'm going to go up to the belly button, and then from the inside, I'm going to go way up here, all the way up to the sternum. All right. And then from the inside, I'm going to find the six-pack muscle, the muscle that's been stretched out, the reason the tummy sticks out here. And then we're going to plicate the six-pack muscle, get the tummy nice and flat like that, and then bring this line down, getting him a nice flat tummy, like a tummy tuck. I'm going to make an incision around the belly button, unbutton the belly button, push back in, pull the skin down, make an incision, pop the belly button out. So that's a 360 circumferential lower body lift, getting rid of all this excess skin all the way around, reducing and lifting the pubic region, reestablishing the belly button, and plicating this rectus abdominis muscle. And that'd be cool.
And that would be snatched. Snatched.
And then also what we're going to be doing is the arms, okay? So do you want muscular arms? Do you want skinny arms?
The skinniest you can make them.
All right, so one order for skinny arms.
Skinny, 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 skinny.
Pair of skinny arms.
Like a lean runner.
So an order of hot wings.
Yeah.
So we're going to make an incision from the armpit out to the elbow like that, because this hanging skin, if I just did liposuction, if he did a lot of working out, the skin would not snap back. It's a very difficult area to get rid of. So we're going to make an incision from the armpit to the elbow and get him literally as skinny as arms as possible. And
yes.
I think that is within reason. So we're going to take you back. We're going to start an IV, and before you know it, we'll be done. Okay.
I'm very excited.
Okay. Yep.
But I know him with the best.
Yeah,
the
thank you.
best of Beverly Hills. Literally,
thank you.
the best.
Thanks for coming all this way cross country for us, and we're going to get you a nice snatched body, top and
So
bottom.
excited.
Okay, let's do it.
And Dr. Katzen, a lot of people believe that Nick does not have any loose skin. He just hides it very well under his clothes.
I do.
Yeah, so show them.
I just, I'll just like, kind of good posture, and then like with my arms, I'll squeeze them and like roll them back, and with a shirt over it, people usually can't tell. They already think I had the surgery.
Oh, okay.
Yeah, but
Not.
it's there. It's just I have a small frame, and it's a little easier for me to hide.
Yeah, so a lot of people say, you know, if you're younger, you can just exercise the skin away. No. If you lose the weight slowly, you can have the skin bounce back. No.
No, I did it very slow. It was
Yeah.
like 8 pounds a month.
Yeah.
Over 2 years.
Yeah.
2.3 years, just a little 8 pounds a month.
So it just depends on your genetics, the integrity of the skin, the damage to the skin, the amount of weight gain, weight loss, all those are factored in. Everybody's individual. But the majority of patients that see me with significant weight loss, 100 pounds or more, you got to do a surgery to get rid of the excess skin.
Yeah, there's
no way
around it.
Hey,
Trust
get
me,
it around it.
I did my research. I was like, anything to avoid surgery, red light therapy, and more vitamin C, and eat more protein, and lose weight slowly, and build muscle while doing it. I did my research, everyone, and nope, there's no way around it.
Yep.
You have to get it physically removed.
Yeah, and that's what we're here for. We specialize in this field of what we call reconstructive surgery after
That's
massive
why
weight
I
loss.
chose you.
There you go.
That's it's his specialty.
Yeah.
A specialty of
Yeah.
dealing with weight loss patients.
Yeah. So let's do it.
We're gonna do it.
Good. I'll introduce you to our anesthesiologist. He'll take great care of you, and before you know it, you'll wake up right here in the recovery room, and it'll be done.
He'll be gone.
Good. Okay. All right. Let's do it.
Hi, Nick. How are you doing? How are you feeling?
Whoa.
Hey Nick, how's it going?
Hi.
Surgery's all done. You did great. You look fantastic.
Oh my goodness.
Everything's flat and lifted, and you got a flat concave tummy, lifted hips,
Wow.
butt without shrinkles. It looks great.
You look so good.
Skinny arms. Yeah, you
So
look great.
good.
You look great.
Ooh.
Do you want to say something to your tummy that you're saying goodbye to? It's right there, Dr.
We
Katzen.
can say anything to your previous tummy before you get rid of it?
It's me.
That's you.
That's your tummy.
Oh wow.
Yeah. A lot of tummy gone.
Oh wow.
So, this is where the belly button was. That was the pubic region. This is the hips. Most of your excess skin is was centrally here over the tummy, and then the hips and it tapers out onto the buttock. So it's sort of like a donut. Crazy, right?
Oh my gosh.
Dr. Katzen, how did everything go today?
So everything went really, really well. I think it's going to be very happy. We got a nice flat tummy, actually concave tummy, rectus plication, nice and flat. Beautiful belly button, and lifted and reduced pubic region. A lot of attention paid there.
No more love here.
No more love handles.
No more love
there.
handles.
No love there. No love there. Also, we got him skinny arms. Got rid of all the excess skin there, so nice tight skinny arms. So I think he's going to be very happy with the results. Now is the healing phase. It always goes with the surgery. Everybody heals a little bit differently. Hopefully he'll have little pain, little to no pain. We'll give him pain medication in the forms of shots and pills, but he'll probably take that medication for, I would imagine, Nick, maybe about 3 to 4 to 5 days, something like that, and then switch over to Tylenol. So for these types of procedures, I have my patients spend 2 nights minimum in the recovery center, okay? So recovery center, my nurses watch him 24/7, make sure he is drinking fluids, getting plenty of fluids, making sure the pain's controlled, making sure his vital signs are stable. And then tomorrow we're gonna get him in a hyperbaric chamber to force oxygen into his tissues to help him to heal. I'll see him bright and early tomorrow in about 13 hours, 14 hours from now. And then I'll see him that next morning after that. And then if everything looks good, we'll get him in the hyperbaric chamber for a second dive. Usually after 2 nights at the recovery center, he is able to be discharged to a local Airbnb or local hotel.
I'm so grateful
Oh, sure, our pleasure.
for you,
Our pleasure.
Dr. Katzen.
Our pleasure.
I'm
You've come a long way, and
so grateful.
you look awesome. Yay. It's all good. It's all good.
Oh, thank you so much.
My
I'm so
pleasure.
grateful. I feel very blessed.
How are you?
I feel like a train ran over me,
Oh my goodness.
right over my stomach, like I just was put on a track, and the train went choo choo, and now I'm like dying. But I'd give it maybe 8 out of 10.
8 out of 10.
So pretty. Like any more, I'd be like whimpering.
Well, the good thing is that the next surgery won't be as painful, not nearly. What's sore is that he plicated your muscle, got it really nice and tight, so you probably feel a lot of squeezing there too, huh?
Yes, but if it gives me a snatched waist, it's worth every ounce of pain.
All right.
Yeah.
Okay, good. I want to show you your results now.
Oh my god. I don't know. Okay, let's count down.
3, 2, 1.
Oh, yay! Oh, that's beautiful.
I know. You look so good.
Oh my god.
Yeah.
Oh my god. See, that's,
And you have skinny arms.
look at those arms. Oh my god. Skinny.
Skinny
Oh
arms.
my god. That's exactly what I was envisioning.
Really?
Yeah.
Good. Yeah.
It's perfect. You would never know I was 400 pounds.
Yeah, you would
Oh
never
my
know.
god. Oh, yay.
Yeah. Do you remember looking at your specimen after the surgery?
No.
Because you did. This was you after the surgery. It was just laying next to you. You were a little out of it.
Yeah.
And then you were like, the last thing I saw was you, and the last thing I talked about was avocados.
Yes.
The last thing I remember was you.
Yeah.
I remember the last thing, I was thinking of avocados.
Well, that makes sense.
Talking about avocados.
Was I?
Yeah. You just saw your results for the first time that you can remember.
Yes. I was just telling her I was in a lot of pain. Oh my God, a train ran over me. And then she showed me the photo. I'm like, oh, no more pain. It's worth it. It's so worth it. It looks so, so good. You would never know I was 400 pounds. And no more love handles. Oh my God. I'm so happy. So, so happy.
You doing okay?
It has been a wild ride.
What was that? At
Wild.
Disneyland, the Disney Toad.
Oh, Mr. Toad's Wild Ride.
It really has been.
Pain controllable.
Right now.
Okay.
Yeah.
Today basically is to just make sure everything looks okay, everything like that. Let's take this one off.
Ooh.
The new Nick avocado. Look at that flat tummy. How about that? And you're swollen, so it's going to go down even more. Beautiful incision line. Good.
Wow.
Looks awesome.
Ooh. I can actually see it now. I couldn't see it for so long.
Hello there,
I knew you were there.
dear friend.
We'll stick that on the back, sorry.
Ooh.
You like?
I love it. Oh my God.
So the incision's nice and low, nice flat tummy, belly button's gonna pop
That's
out
a
there.
beautiful belly
Yeah,
button.
I think so too.
Good.
So,
Wow.
nice flat tummy. It's gonna be a little bit swollen from here down. That'll go down.
Mhm.
Maybe a little bit nummy in there too, but that's all normal.
I'm so excited. Oh my God. Oh my gosh, it's beautiful.
Yeah, it's all you. It's all yours.
Wow, that was under here the whole time.
Yep. All right, very good. So let's get you laying down here, and then we'll take care of a lot of this other stuff.
I've kind of been like in a haze. It's been really crazy with the medicine, the sleep, the jet lag. Even though I've already been here 4 days, it still feels like I'm all over the place. But the big thing about this appointment was I got to see for the first time what he did. It's been all wrapped up and bandaged this whole time, including my arms, and I haven't seen anything except little sneak peeks that they showed me. It's gonna take some time to get used to, because it's like, to me, it's like, that's not me. I'm looking in the mirror, I'm like, that's not me. That's like, it feels very foreign. First impression, the belly button is beautiful. It looks better than like real belly buttons. I mean, it's still real, but you know what I mean? It's like a good belly button. And my body's shape, I don't know if it's the swelling or it's just, because it's the first week or so, but it has a really nice, it just has a beautiful shape. And I actually really like it. It's so pretty and flat, and I can stand straight, and I can see my manhood.
Woo! Yeah!
Well,
Manhood!
yeah. And all my mukbangs over the years, that was always a running joke. A lot of you peasants might remember. I would be like, well, Orlin used to say, be like, you can't see your pickle. I'm like, yes, I can. He's like, you have a big fupa, it's in the way. Like, you're a liar, peasant. All that type of stuff. But that actually stemmed from truth. I mean, like, I actually couldn't see. And the funny thing is, that was at like 350, 400 pounds. Now I'm at like 170 pounds. Well, I guess 160 now, since 10 pounds of skin just came off. So I'm 160 pounds, and I still couldn't see it because all my muscles were broken, pushed out forward, and they were just dangling in front of the goods. So it feels really cool to be able to look down and see my toes and my manhood, and no belly hanging there, a waist that I've never had before. I'm leaving.
He's being discharged.
It's been so much fun. It actually really has been. And I love my body. I got a body by Katzen.
Yeah.
Body by Katzen.
Body by Katzen.
Literally.
Have a safe flight.
Thank you. I'm gonna miss you guys.
We'll miss you too.
literally like 2.5 weeks. I'll be right back. I'm getting a full body by Katzen, head to toe.
Bye. We'll see you
Bye.
guys later. Bye. Thank you for
Bye,
having me.
guys.
Thank you.
guys.
Bye.
Bye. Love it. Oh my god. I think that's gonna make the video even